Okay, guys, so Shauna went through and informed me of a bunch of grammatical errors she found in notes. So, this is a little video to help sort of explain how the notes need to be documented when we're doing a new patient examination, because that's when the mistakes are happening, is always in new patient examinations. So we have essentially 3 templates. 2 of them are part 1 and 2, and that's when we discussed before. That's for the perio exam, because you can't take a step away from the note when it's prompting you so that you can do a periodontal chart and do missing teeth. So that's why that one's split into 2. So let's just open this one up and let's take a look at it. So the first question, obviously location. But the second one is actually where all of the grammatical errors seem to be occurring. So in this first question, this is my motivational interview. So this is when I'm sitting down talking to the patients about, their dental history in the past, why they were referred, and essentially what they want to do to change their smile or the health in their mouth. So what you got to do is, if you're not going to form complete sentences, you got to do this one of 2 ways. You can either have complete sentences or you can do bullet points. Now I've broken this down into 3 categories, okay? Past medical and dental history. This is where you're going to enter information that's valid. Okay, I don't care about what they did last summer with their grandma at, their cabin in, frickin' South Carolina or something. I care about valid information, and that includes, past medical history, heart stuff, joint replacements, serious infections, stuff along those lines. And this section should also include dental treatment. Did they have a bunch of dentistry when they were kids? Did they have a bunch of teeth taken out? Did they have previous history of periodontal disease? That's actually really important, because I need to know if they already had surgery or if they had scaling and root planing. So if you're going to enter this information, like let's say, for example, the patient has, they had heart surgery to replace a valve 2 years ago. Just do it like this. Valve replacement surgery 2 years ago. And if they had scaling and root planing a long time ago, then say, they're going to give you a guess, like, I don't know, maybe 10 years ago. So history of deep cleaning. So put history, SRP, 10 plus years ago. That's great, okay? That's how this can be entered. If you're not going to form complete sentences, do it in bullet points. Okay, so the next set of stuff, and remember, you're going to have to be actively listening, because this stuff's going to pop up randomly. I let the patients guide the conversations on purpose, okay? The patients are there to tell me about their lives, and when they're talking and I'm listening, they're becoming more and more comfortable with us at the office. So you have to pay attention. You need to weed out useless information and add important stuff. Again, I don't care that little Susie has a soccer game on Saturday, right? That's for scheduling up front. What I care about is, the important things that are to be included in the note that are clinically related. All right, so the next section that's going to pop up once we stop talking about medical and dental stuff, or maybe it happens before. Maybe the reason for their referral pops up before they talk about medical history. So then jump in and add it here. And the patient says, well, I don't really know why I was referred, but somebody says I have gum problems. Well, then write patient unsure why they were referred. And then write possibly referred for gums. Something along those lines, It has to be, I want this in the patient's words, so it's subjective information, but it has to be entered correctly like this. And then, at some point I'm going to be asking the patient, what are their desires? Because remember, this is a motivational interview. So I'm trying to dig deep into what the patient is motivated by, what's important in their life, and what are some serious changes that may occur in their lives if their dentition continues to fall apart. So here what I'm basically trying to get at is, okay, what don't they like and what do they want to change? If, they are worried about their cardiovascular health, then put that there. If they're worried about, you know, loose teeth and not being able to chew, then put that there. You know, patient concerned with inability to chew due to mobile teeth. And you know what? That's okay. I know you guys are typing fast, and if you misspell something, then that's fine. You can go back. In fact, that's actually really important. That brings up a very important point. Let's say I finish this note, okay? Well, there's a spell check button here. I want everyone, when they are done with their notes, to hit the spell check and review the notes to make sure that the things are spelled correctly. Really, I mean, we all have high school educations. You all know how to form complete sentences, and you know how to spell things. If you don't, you at least know how to click on buttons to spell it correctly, okay? So that's where I'm going with this stuff. So hopefully this little video can help you guys, you know, now you're in my head, you understand how I think and how this note needs to go. So let's see if we can clean these notes up this week. All right.